Ben Taub is incredibly important for our community. It's one of 2 level 1 trauma centers that we have in our community, where we should have 4. When the ambulances keep coming or patients keep walking in, we'll take care of them. We're over 100% capacity. For a hospital to be efficient, it should be around 85% capacity. That means that you have time in between one patient and the other to clean the bed, turn around the room, and do it in an efficient manner. When you're above 100% capacity, you start losing some of those efficiencies.
When the hospital's saturated, it affects the whole hospital. My day is about making sure that patients get their care and are running through the process of the hospitals. Hallway beds are when there's so much level of saturation, there's so much overcrowding, that in order to be safe for everybody, that we house somebody who needs to stay in the hospital in the hallway while awaiting a more permanent bed.
So that does mean that we have to treat patients sometimes in the hallway. It's not ideal for us. In the hallways, the noises are loud, the lights are bright, there's a lot of distractions going on, and that's not ideal for healing. We do risk the concern of patients having higher fall risks, patient safety incidents, but it does stretch our nursing staff and our techs and our physicians very thin because we're having to make so many accommodations.
On a given week, I would say at least 5 out of the 7 days, we probably have patients that are in our hallway spaces. So when those individuals are in the hallway, it's challenging for them, but it's also challenging for all the other patients that are moving throughout the unit. We have to direct traffic different directions to be able to move patients fluidly without causing harm to the patient in the hallway, the patient that's in that bed that's being transported, as well as the team members that we have to take all into consideration.
It is always an honor and a privilege to take care of patients regardless of where they are, but it can be very challenging to provide the best compassionate care to patients who are stationed in the hallway. And patients are reluctant to share information that is vulnerable, that's sensitive, that they would usually want to share with their doctor. And so that just means that it takes longer to get the information, to get to the right diagnosis. It takes longer to actually get patients on the right treatment.
My son was having symptoms of a heart attack, and I said, we take you to Ben Taub. And he was there. He had to stay in the hall the whole time. You can't help but worry. I mean, for me, it was like, is my son gonna be all right? Are they noticing him? There's no button. They don't have the order of being in a room. You feel like, are they noticing? So it's very stressful to the family member or the patient.
Our patients here at Ben Taub usually do have family members with them, because what families do is they not only are helpful for the patient, they're there for them to help reduce stress, to be there as a comfort system for the patient, but they also really help us. They're the ones that can advocate for their family members.
When the patients are unfortunately in the hallway, it really limits that volume of individuals who can be with their loved one at that given time, and typically that's one individual. It's very tight in terms of where the stretcher is in comparison to where the chair is in terms of the proximity of how much space the patient has.
Our utilization team looks at our bed, at all of our resources in general, to make sure that we're as efficient as possible. Every day there are several huddles where the team gets together, looks at how many patients we have, how many beds we have available, to ensure that we're using our beds the optimal way for our patients.
Having 100 more beds could have made all the difference.
We are all trying to do the best that we can for our patients, but we need help in having a new facility to maintain all the goals and the metrics that we aim to achieve, and to really be that safety net for the city of Houston.
At Ben Taub, we treat the entire Houston community. We treat patients regardless of their background, what walk of life they're from, and whether they have insurance or not. Medicine is about getting the right diagnosis and the right treatments, but it's also about this compassion, this kindness, this dignity that we're able to provide for the patients in our community.
I think about we're at a point in history where we have to make the next step. This is just the way that the evolution of excellent systems happens.
100 additional beds for Ben Taub Hospital would mean that we would be able to fulfill our commitment to our community, that we will be able to meet the demands and take care of our patients and our community the best we can.
It's time for a better, bigger Ben Taub.